Hi, my name is Juergen Rockstroh from the University of Bonn, and I'm going to give the con standpoint in the debate. Do integrase inhibitors and or TAF lead to weight gain? This is my conflict of interest. Now, who do you think is the true expert in weight gain, Laura or myself? Well, obviously, I know what obesity is all about. So, trying to take the perspective of con, I have four topics I want to touch upon. First-line therapy and weight gain, switch studies, in PrEP, and in a changing patient population. So let's start with first-line therapy. Even before the introduction of integrase inhibitors and TAF, look at the mean change in body mass index at year 1 to 5 under common NRTI and PI-based regimens. And you can see everyone has gained weight. That was a normal phenomenon of return to health, which happened to anyone who was treatment naive and started antiviral therapy, long before integrase inhibitors became the preferred regimen. And indeed, this weight gain after starting antiviral therapy had a positive impact and was associated with lower mortality, particularly if you were underweight or normal weight when you started HIV therapy. So after all, this may be beneficial. So weight gain good after all? Well, clearly a lot of our patients want to gain weight because they want to be more attractive, and they go to the gym every day to try to achieve that. If you look at the different treatment-naive studies and weight changes up to week 69 for some of the more recent drugs, you can see that the weight gains were very similar to the first paper I showed you, which was also an average around 2.5 to 3 kilograms. That's exactly what's happening. There's only one study which is sticking out, and that's Advance, which was done in South Africa. So maybe differences in patient populations from certain regions may not be overinterpreted for that reason. There are also other African studies, which are far less reported, but also looked at change in body mass index, which is increasing as HIV therapy has brought an improvement in health and well-being of people living with HIV, and so there's more weight gain, but there was no effect of type of regimen or duration of heart on this weight change. And clearly there are cultural differences. So most Africans think the following when it comes to weight gain. It's a sign of good health and wealth. It's a blessing from God. When you have a large stature, you're taken more seriously. Potbellies call this siakafu, signify wealth. And indeed, the number of people stopping therapy because of weight gain is very low in the advanced trial, suggesting that indeed people are not suffering from weight gain. And so if you don't suffer from weight gain, you may also not do anything against it, like increase physical exercise and go on dietary restrictions. Let's look at some switch studies. Now, obviously, they're much more prone to give an answer around weight gain because people are on a stable regimen and this health benefit, return to health phenomena is not necessarily playing the same impact. And this is from Laura herself. Look at the very modest weight increase in a dolutegravir-based regimen around 0.8 kilogram. That's what, when I go out for a meal and some beers with the boys, exactly what happens the next day. So is that really something of concern in a patient population which is aging and gaining weight? Is 0.8 that much different? Look at the Tango trial, looking at weight changes from baseline for those who remained on a TAF-based regimen versus those who were randomized to receive only dolutegravir 3TC, so dropped the TAF. And you would expect that would have an impact, that they would lose weight because they're not taking TAF, which supposedly, as Laura is saying, causes weight gain. But indeed, there is no difference, and there's actually no TAF-induced weight gain in this study. Factors have been addressed around weight gain among ART experienced virologically suppressed patients. And I think one of the main things which comes out of this is that every cohort seems to have other factors. In this particular study from the US, absence of weight gain was associated with hypogonadism, overweight or obese at baseline and PI use. And interestingly enough, the association between integrase inhibitor-based ART and weight gain was only significant in the bivariate analysis, but not in multivariate. So are we just mixing too many things together? Is there really a true independent effect of integrase inhibition? Let's look at the PrEP studies. The PrEP studies are ideal in asking the question of, is there really a weight gain with TAF? If you look at IPREX where you compare placebo with TFF, you see there is more weight gain with placebo and there's a little weight drop in those receiving FTDF. There's also a little bit of initial weight loss in Discover, where FTDF is compared with FTAF. So maybe it's not that TAF leads to weight gain, but TDF leads to weight loss. And that is sort of dismantled if you give TAF, because that doesn't induce the same weight loss which is associated with TDF. But in all of these studies, including the cabotegravir study, which looked at cabotegravir versus placebo in a prevention trial, also showed a kilogram of weight gain. So it's not a TAF independent effect. It seems to appear independent in an aging patient population. This came out also nicely in the updated figure from the cabotegravir trial, which is compared to TDF-FTC. You see again the initial weight loss with TDF and the weight increase with cabotegravir, but then that really levels off over time. So it doesn't seem to be an independent effect. And remember, cabotegravir is also an integrase inhibitor, which does not seem to be associated with weight gain in this particular trial. So let's not forget that we're also talking about a changing patient population. Why do people gain weight as they age? Well, they are having changes in their diet, sedentary lifestyle, genetics play a role, social determinants, medications, or hormonal imbalance. We all know that we're struggling much more and we have different movement patterns when we get older. Is COVID-19 also like an integrase inhibitor? Self-quarantine and weight gain related risk factors during the COVID-19 pandemic, a paper just recently published, really shows that self-isolation, lockdown, less possibility of going outside and exercising had a tremendous impact on weight gain. So let's not forget that we're also having other factors than antivirals, which impact weight gain considerably. This is obviously in particular increasing obesity rates, not only in the US, but in Western Europe as well, and also in Africa, with the well-being associated with HIV treatment and control of viral replication. Our patients are having much higher body weight when they start antiviral therapy than 20 years ago. This is also shown in this paper, which addresses the rising obesity prevalence and weight gain among adults starting antiviral therapy in the United States and Canada, re-emphasizing that we're talking of different patient populations today when they enter treatment trials. And clearly, for many groups, being a little bit more on the chubby side is attractive. Think of all the Bear Week events in Sitges, for example. This was prior to the COVID epidemic, obviously. People enjoy big, chubby, hairy men and have fun with them. So culturally, things are changing. Weight gain occurs irrespective of the chosen ART regimen following ART initiation. It's dependent on CD4 count and clinical disease stage. It's a return to health phenomenon. Switch to dolutegravir is associated with a minimal weight gain, less than 1 kilogram in 96 weeks. That's not much more than what we usually gain over time. Associations with risk factors such as gender remain controversial and are not found universally throughout all cohorts. HIV patients are aging and therefore more prone for metabolic change, just like the general population. Don't forget there are other factors like COVID-19 or stopping smoking, which also impacts weight gain. So please vote for the con position. Thank you.